Thank you, Sahani sir. Good evening, good afternoon, and good morning. This is the 1592nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NIKUNJ M. Trivedi. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in English, Hindi, and from 7:30 to 8:30, and from 8:30 to 9:30, we have an international session in English, and from 9:30 to 10:30, local language session in Malayalam. We have homeopathic doctors, eminent personalities from different 65 countries have presented various sessions in this forum, and all those papers were brilliant to promote homeopathy. The purpose of International Forum for Promoting Homeopathy is to promote homeopathy among public as well as connect doctors around the world together. And this is what we are doing for the last 1,591 days. And today we have one of the finest faculties. As you know, Dr. NIKUNJ M. Trivedi, he has he is working at RT Clinic since in UK since 1980, and RT's Advanced Clinical Homeopathy Center is there, and Dr. NIKUNJ is specializing in treating fertility problems and chronic diseases, and has authored 4 books on in different subject on this subject, and he has received his degree with a gold medal in homeopathy in 1980 from India, and has 43 years of versatile clinical experience. He obtained further training in medicine, gynecology, and surgery, and started his own private practice in India. Later, he shifted to the UK. In the meantime, he has practiced in both the UK as well as India, and he is a fellow of British Institute of Homeopathy. He is a fellow of Royal Society of Health. He has been awarded the Man of the Achievement in 2002. He is affiliated to many homeopathy organizations around the world, and he is a board member of Homeopathy for Children in Charity UK. He has been an honorary lecturer at the Department of Clinical Therapeutics at Homeopathic Medical College, and he teaches homeopathy. Dr. NIKUNJ has published many articles and research papers and conducted many seminars and lectures in the field of infertility and homeopathy. He has treated more than 2 lakh patients in his 43 years of clinical practice, and he is more concentrated. He is a successful personality in all the field which he handled, and many patients from USA, UK, Africa, Bahrain, Canada, Norway, Nepal have been to him for fertility treatment in India from 1080 to 2004. He has settled in the UK in 2004 and having a huge private clinical practice in Leicester, and he is not only doing the practice but also motivating the doctors around the world by giving seminars in UK also. His vision has unfriendly enthusiasm and ability to simplify the complex conditions were recognized repeatedly throughout his clinical practice, with awarding highest clouds of excellence in practice and by his patients, students, and colleagues. He has attended to simplify the complexity of advanced clinical conditions by presenting his 4 books to homeopathy clinic. Dr. NIKUNJ Trivedi began his career in India. Then he shifted to UK, I already have mentioned, and he is a life member of Homeopathic Medical Association of India, HMA, GHMA India. He is currently serving as the chairman of UK HMA. Dr. NIKUNJ has served at the charity clinic and regularly participating in the Homeopathic Awareness Week. He also runs a sitting in clinic and clinical training sessions for students and homeopathy. And the doctor has presented so many papers in this forum and one of the leading presenter in IFPH also. So everybody is waiting for the session. Today, doctor will be discussing about HICCUP and homeopathy, a very, very important subject. Welcome, sir.
Thank you. Thank you very much. Am I audible?
Yes, sir.
Okay. So let me tell you that what has happened will happen again. What has been done, we still must do. Nothing under the sky is entirely new. So whatever I am sharing my thoughts on the IFPH platform, I feel proud for that, and knowledge is always to be shared. So I selected a simple topic today, that is homeopathy and hiccup. Hiccup we consider as a very simple thing. Hiccup everybody must have experienced at some point of their life. It's acute when it is benign. But when it becomes chronic, then it needs a definite attention of the practitioner. How to resolve and how to cure. So here I would like to request to share my screen with you.
Yes, sir. Definitely you can.
Okay, is it visible clearly?
Yes, sir. Fine, sir. Everything fine.
Okay, so let us start with the hiccup. Yes. What is hiccup? You have heard the sound that what is hiccup. You must have also experienced what is hiccup. And you must have tried all the home remedies just to get rid of the hiccup. But when it becomes a chronic, when it becomes a persistent, then it needs a serious medical attention to rule it out, and how our homeopathy is working to cure, to abolish the hiccup, that we will discuss in today's session. So hiccup, the scientific name is singultus. It is derived from the Latin, and singultus means gasp or sob. In our repertory, we have come across a lot of rubrics like gasping and sobbing. So the same word, singultus, has been derived from the Latin, and the meaning of the singultus is gasp and sob. It's involuntary myoclonic contractions of diaphragm. It is not in our control. It's a very, very important for the respiration, and it's involuntary phenomena involving the reflex arc. And what is reflex arc? It's a neural pathway which controls the reflex. So when the hiccup reflex sets, it goes continuously. And that's why we got a hic sound like this. Sorry, let me go back to this slide because I want to explain about the diaphragm, the glottis, and the phrenic nerve. So diaphragm is basically supplied by phrenic nerve and vagus nerve. Phrenic nerve is originating from the C3 and C4, which is exclusively motor in control, while vagus is mixed now. It's a sensory and motor. And there are two vagus, right and left, the same way, two phrenic, right and left. So spasm of our diaphragm, which we can't control, causes hiccup. The diaphragm muscle, it goes in spasm. And diaphragm is separating the chest, means the thorax and abdomen. It's a partition between thorax and abdomen. So in that area, it plays an important role in breathing. This spasm causes our vocal cord to close briefly. And that's why we are getting the sound of hic. It's an abrupt thing. It's not in our control. It can come at any time with any condition which can cause the increased intra-abdominal pressure, where increased abdominal pressure is stimulating the diaphragm. It's stimulating the phrenic nerve. It is stimulating the vagus nerve. Then patient starts hiccup. So that's why it is an abrupt, involuntary, which is beyond our control. It's a myoclonic contractions of the inspiratory muscle repeating several times per minute. The resultant rush of air into the lungs causes the glottis. Glottis means the opening between the vocal cords. So the resultant rush of the air into the lungs causes the glottis to close repeatedly, and which producing a characteristic sound that is called the hic. Now, coming to the types of hiccups. There are varieties of hiccups. Considering first, acute hiccups, which we have experienced in our every stage of life. Sometimes if we laugh a lot, if we are having a fizzy drink, if we having some spicy food, when there is irritation, or if somebody having acidity, then also they are developing a hiccup. Certain medicine also developing and precipitating hiccup. After anesthesia, also a patient develops hiccup. But as we go back to our early life, we don't remember that we had a hiccup when we were baby. But if we observe the baby, when baby having a bottle fed, or when baby having a breastfeeding, at that time there is a aerophagy, means they also suck air along with the milk. And that air goes to the stomach. And newborn baby, neonates, they develop hiccup. So this is the first stage of hiccup when it starts from the infantile stage, the newborn stage, which is benign. Benign means not harmful. It's not causing any harm to our body. It's self-limiting. Acute hiccups are always self-limiting, and it is lasting for less than 48 hours. Benign hiccups are very common, and it affects people of all age. Anyone can get that hiccup, but males are affected more than female. And ratio is 4:1. While psychogenic hiccup, because females are more prone to the emotional aspect, having a more emotional, and sentimental approach. And that's why they develop hiccup with psychogenic origin, and that we will discuss later at the end of the session, that what our homeopathic medicine is working on which ground. So this is the acute type of hiccup. Now we are coming to the chronic hiccup, which lasts for more than 48 hours. It occurs in recurrent attack. It comes, then it vanishes. Again it comes, it lasts for a couple of hours, again it vanishes, again it comes. So repeated and recurrent attacks happens with the chronic hiccup. And causes are, as you know, that nerve damage, tumor, cyst, or growth on thyroid gland, reflux esophagitis, chronic laryngitis. And if we go very deeply in deep pathology, then we can say that vagus nerve irritation can result, chronic nerve irritation can result in a chronic hiccup. And it lasts for more than 48 hours. Now we are coming to the intractable hiccup, which lasts for more than 1 month. Surprising, no? Have you ever come across any patient having a hiccup which has lasted for more than 1 year, 1 month, 2 months, 3 months, like that? If you can come across any patient, think about the deep-seated pathology. Because intractable hiccup may make us to think about the abnormal pathology. And our duty is to bring that abnormal pathology to the normal physiology. That is, Hahnemann has said in aphorism first, to restore the sick to health. So hiccup may occur in up to 9% of the patient of advanced cancer. Up to 20% of patient with Parkinson disease. In my previous sessions, I discussed about the Parkinson neurological disorder. And in my session also, I emphasize more on the hiccup with the Parkinson patient. 10% patients with reflux symptoms, reflux esophagitis. Recurrent hiccups compared to approximately 3% of the healthy individuals. So when patient having a Parkinson having always motility issue, ataxia, and the movement of the esophagus becomes quite weak. So when patient try to eat the food, the bolus, when bolus try to reach at the end of cardiac end of stomach, patient develops hiccup because of the irritation. And with the advanced pathology, with the underlying cause, and considering the vagus nerve stimulation, vagus nerve irritation, which can result from many pathological conditions. First of all, we consider the foreign body irritating in the tympanic membrane in the ear, which can trigger up the hiccup. So when patient comes to us with a hiccup, and if it's a chronic origin, we must examine the ear. Pharyngitis, laryngitis, goiter, any cyst in or around the neck, pneumonia, emphysema, bronchitis, asthma, pleuritis, esophagitis, aortic aneurysm, tuberculosis, lung cancer, and core pulmonary, COPD, chronic obstructive pulmonary disease, when patient is gasping. With that gasp, with that sob, there is irritation of the phrenic nerve because diaphragm is going under stress, under pressure, and that's why patient is developing a hiccup. Causes. Let us evaluate the causes. Fizzy drink. Right now, if we observe the society, if we go to the restaurant and if we say that majority of the people, they order a shot of a fizzy drink along with their food, and that effervescence is producing a lot of gas. That gas is pressing under the diaphragm, and then patient develops hiccup. Drinking too much of alcohol, that also irritates the stomach, and patient is developing a hiccup. If you remember some movies, if you have watched the Hindi movies, the hero or the comedian who indulge with the alcohol and they develop a hichki, the hiccup. Kesto Mukherjee is a master of doing acting of the hiccup along with the alcoholics. Overeating. Overeating is also precipitating the hiccup. And that is also causing a sort of a increase in intra-abdominal pressure. That intra-abdominal pressure is causing a pressure on the diaphragm, irritating the phrenic nerve and irritating vagus nerve, and patient is developing a hiccup. Excitement or underlying emotional stress with the patient. Here I'll narrate a story of one gentleman. That gentleman was working as a clerk in one private firm, and he developed a hiccup. He went to several doctors. He tried everything which was available on the earth. He was not relieved. All the tests were negative. No cancer, no tuberculosis, no pharyngitis, no pneumonia, nothing. Emotional factor was excluded. Actually, I have not seen that patient. Our teacher was telling this story to us, and I remembered that by heart. So ultimately, his hiccup was giving a lot of irritation to his boss. His boss was telling that better you take some advance and go to some good consultant. He can cure you. But unfortunately, he remained unsuccessful with all the efforts. So ultimately, boss was fed up and the clerk was also fed up. So one day he entered in boss cabin with a hiccup. And boss has really fired him, scolded him, that better you go back home and don't want to come again to my office. I don't want to see your face. And he was shocked that my hiccup has made me to lose my job. He went straightway. Very next day, the boss rang him that come back to the office. He went back to the office with a shivering, with a frightened feelings that now what will happen to me, whether my pension will be left. But when he entered his boss office, boss was smiling. Welcome, come back and see where your hiccup has gone. This shock treatment we consider here as a excitement or underlying emotional stress. So this is very important. Sudden shock is taking out the emotional stress out. That makes person to get frightened, and that works as a remedial solution for the hiccup. So sudden thermal changes is also one of the factors which can cause the hiccup. Aerophagy means swallowing of the air while chewing gum or while smoking. Smokers also getting a lot of hiccup. And overstimulation of the phrenic nerve, as I have discussed before, because phrenic nerve is supplying to the diaphragm. When diaphragm gets stimulated, patient develop hiccup. Here I would like to draw all of your attention that when I was working in the gynec department, we used to do the Rubin's test. We were inflating the fallopian tube by injecting the carbon dioxide intrauterine. And after 4, 5, 6 hours, I used to do the screening of the patient by making her to stand in front of the screening machine, and we can see a collection of the gas under the diaphragm. And when there's a collection of the gas under diaphragm, and when patient was complaining the pain on the left shoulder, that was the confirmatory test that patient's tubes were patent. And after that, many patients used to develop a hiccup. Many patients. And in gynec hospital, my boss, he used to give a shot of antacid to suck, and patient was getting relieved. So we will explore the homeopathic part as well, that what we can do with the relief of the stimulation of the phrenic nerve, or with the irritation of the diaphragm. So overstimulation of the vagus nerve. Vagus nerve is, vagus means wandering. It's the longest nerve, longest cranial nerve in our body, and which carries sensory and motor fiber. So vagus was also causing a sort of a hiccup, irritation of the diaphragm. And in surgical aspect, when patient having a lot of reflux, lot of hiccup, what surgeon used to do? GJ vagotomy, means gastrojejunectomy and vagotomy. They cut the vagus nerve and then they tie the vagus nerve. I have witnessed this surgery. I have assisted this surgery plenty of time. And after that, patient never complained about the reflux, because there was no any sensory and motor sensation patient used to feel. So this all about the causes, this all about the types of hiccup. And now what our homeopathy, our clinical homeopathy says about hiccup. So let us discuss some important homeopathic remedies for hiccup. And Nux vomica, Brownia, Hyoscyamus, Ignatia, Sepia, these are the remedy of choice. So let us discuss about the hiccup pathology with the Nux vomica. If we look deep into the Nux vomica patient having a sour taste and nausea, especially in the morning before eating. When patient is on empty stomach, patient develops a lot of gas. And this sour taste shows that with the gas needs to come out. Either it comes by mouth or from back passage. So when gas starts to come out at that time, patient feels sour taste and nausea, especially in the morning before eating. Patient feels weight and pain in stomach, and worse after eating, sometime after food. Flatulence is the prominent symptom of Nux vomica. Heartburn. Other name of heartburn is pyrosis. It's a old English, which you will find in a boric. So pyrosis means heartburn. Patient having a lot of heartburn. Flatulence is making patient to feel more heartburn. And what is basic pathology of heartburn? esophagus having a alkaline pH and stomach having a acidic pH. So when acid and alkali both mix together, it generates heat and burning. That's why patient is developing a heartburn. And region of the stomach is very sensitive to pressure. Epigastrium bloated with pressure of a stone, as if stone is lying in the epigastrium. Many times patient complains that it's quite heavy in a chest, where then patient shows with the finger in the epigastrium. Bruise soreness of abdominal walls, weakness of abdominal ring region. So weakness of abdominal ring region is a confusing. It's a inguinal ring or cardiac sphincter or duodenal gland. But in Boric, it has been mentioned that it's a weakness of the abdominal ring region, and I consider that it's a cardiac sphincter of the esophagus, of the stomach. Patient having a strangulated hernia and patient also having a severe constipation. So severe constipation leads to the increase in intra-abdominal pressure, and that intra-abdominal pressure is making patient to develop a lot of flatulence, and that flatulence, that gas wants to come out. So the reflux is causing a heartburn and sour taste in mouth. So this is a pathology of nux vomica. And when you find such type of symptoms, and if you administer nux vomica in a proper potency, right potency, patient gets relieved quickly. Okay, now let us go to the another remedy, that is sepia. So sepia, as you know very well, that sepia, the cuttlefish, nausea with the smell and sight of the food. Patient cannot bear, patient cannot tolerate the smell and sight of the food, especially in the morning before eating. The same thing like nux vomica. But sepia patient having a longing for the vinegar, acid, and pickle. These are the abnormal appetite. Vinegar is very sour in taste. Acid is also very sour in taste, and pickle are also sour. This abnormal craving makes patient to get more irritation in the stomach. Sepia patient is worst after milk, feeling of goneness, not relieved by eating, and nausea at smell and sight of food. This is a very typical symptom of sepia. This sepia patient, the sepia complains that nausea at smell and sight of food, that we can also consider for the hyperemesis gravidarum, early pregnancy, when patient is complaining of the nausea and vomiting. Ipica is also one of the remedy for that. And tobacco dyspepsia, those who are smokers. Smokers always having aerophagy. They indulge air. When they suck, the puff air goes inside. That air gets trapped. Either it comes either from the back passage or from the mouth. So with that also, there is a reflux, and we call that tobacco dyspepsia. Abdomen is flatulent with headache. Liver is sore and painful and relieved by lying on right side. This is sepia. Now we are coming to hyoscyamus. Hyoscyamus, very good remedy for nervous disturbances. And hyoscyamus patient always having a hiccup, eructations empty, and patient get bitter taste in mouth, nausea with vertigo, vomiting with convulsions, colic as if abdomen would burst, and patient feel distended, bloated. Patient get borborygmy, means rumbling, and colic with vomiting, belching, hiccup, and screaming. Tympanitis means distension. So this all about the hyoscyamus. Now coming to the brownia. If we remember the brownia having a severe constipation, dryness of all mucous membrane. And with the dryness of all mucous membrane, patient having a very hard stool, as if stool is burnt. Liver region is swollen, sore, and tensive. Burning pain with stitches. Aggravation from pressure, aggravation from coughing, and aggravation from breathing. So all this aggravation, if we consider, it shows that any increase in intra-abdominal pressure brings all these symptoms to the Brownia patient. Dyspeptic ailments during summer, aggravation in hot weather, and aggravation from cold drinks, fizzy drink, chilled beer. Fermentation, effervescence, production of the gas, lacking of the digestive juices from the stomach. Overeating always cause the lack of secretion of the digestive juice, because whatever digestive juices has been secreted by the stomach mucosa, it has been utilized. So these are the factors pathologically we should always consider. Now we are coming to the ignatia. As we discussed earlier, hysterical element. Ignatia patient having an effect of grief and worry, suppression of emotions, bad effect of shock, loaded anxiety, St. Vitus dance, chorea. Ignatia is very good remedy for it. When I presented earlier in neurological disorder, I explained about Ignatia and St. Vitus dance. So, hysterical element makes patient to behave weird and very funny. And always patient dwells on the same and same symptoms again and again. And that's why it is called the hysterical element. Ignatia patient having a always aversion to ordinary diet. And Ignatia patient having a longing, craving for the great variety of indigestible food. The same thing we have seen in a calcarea carb. Calcarea patient is also craving for the indigestible thing. Same way, Ignatia patient is also craving for the indigestible food, indigestible things. But difference between Ignatia and calcarea is calcarea patient is always hardworking, overworking, capable, and conscientious, while Ignatia patient is always hysterical. Ignatia doesn't have full moon, new moon aggravation, while calcarea having a full moon and new moon aggravation. Calcarea patient likes lot of water. Patient can't eat, can't live without water, while Ignatia patient does not have any affinity for the water. Ignatia patient having a craving for the acidic things. So patient has sour eructations. Patient has much flatulence. And that much flatulence is making patient to develop a hiccups. Patient having a sinking feeling in stomach and relieved by taking deep breath. So we consider this thing as a sign. Ignatia patient is always sign, panting, gasping, needy, pleady, always asking for the help, always asking and looking for the sympathy. That is Ignatia. And when Ignatia patient comes to you, when you take a history and when you come to know about all this hysterical element, Ignatia will work like a magic and hiccup will stop very quickly. So this all about my publication, Repertory of Infertility, Metromedic of Sexual Disorder and Sperm Disorder, and Homeopathy, that already I have published. And here I'm ending my session. Hope you have enjoyed. And if you have any question, you are always welcome to ask me. I'm here to answer any of your doubt or any of your questions. And thank you for listening me. And thanks for your great support.
Thank you very much, sir, for an excellent session on hiccup and homeopathy. As we all know that this is a common problem, we used to get patients of this hiccup, at least one or two in minimum week, I must say. In those conditions, homeopathic doctors can do wonders with, as you rightly point out, some of the medicines also. But when we look at in the practice, we may have different medicine also. These are some of the medicines sir has mentioned, but there are so many medicines that may come into the picture as and when it's required. For example, if there is the hiccup is a violent type, then Veratrum will do wonderful job. We have seen such cases before. And in some other cases also, we have different remedies. According to Dr. Pathak, he has shown many remedies, particularly single rubric remedies for this hiccup. Anyway, sir, the beautiful presentation indeed. It's the time
Thank
for
you.
discussion, and those who want to participate in discussion may raise your hand. Yes, Harihan sir is always there. Yes, sir, you can begin the session. Ask your question also. Please unmute.
Hello, sir.
Hello.
It is a very good session.
Thank you.
And I like to add some more thing. That's all.
Sure, sure.
See, the hiccup during pregnancy,
Right.
that cyclamen and opium. There is two main medicine. That is, one is I call cyclamen and other is opium. Then another medicine is that if the patient is having profound saliva, profuse flow is there, that lobelia is one of the best medicine.
Good.
Lobelia. See, another medicine is the hiccup is during sleep. That is, Mercor is one of the best remedy. You already said about Ignatia, but one thing you forgot, I think. That is, Ignatia is smoking from. If
Yes,
hiccup
that was
originates.
mentioned, sir.
That should
Having
have,
an aversion with the tobacco.
That was
that's the tobacco. That okay. Thank you, sir.
Ignatia doesn't tolerate tobacco. If somebody is smoking outside and patient is just passing through that, patient develop a sort of aversion for that. But for the sapia, those who are smoking, and that is called the tobacco dyspepsia. Even in terms
Sir,
of
okay.
in terms of hiccup, we can write down a whole repertoire on it, because it's such a wide subject, and here I am having a limitations of the time, so I cannot describe each and everything in detail. Otherwise, there are so many remedies and small remedies like salol, scatol. These are the small remedies which has only single use. With one line only, they have indicated its indication with the hiccup. But the majority of the remedy which is being used as a polycris, that what I have elaborated over here. But definitely whatever you have suggested, I will make a note of it. And whenever I get a chance, I'll use in my practice as well. Thank you for your suggestion.
Okay, sir. Okay, sir. Thank you very much.
Thank you.
Dr. Dhanesh, you are muted. Dr. Dhanesh, please
Sir,
unmute.
yes, it's a time. Please.
Myself.
Hello.
Okay, sir. Very good section. It was a very excellent session. And you covered the pathological aspects also. So what about the dosage and all? So what is
Doses.
the repetition?
This is,
Repetition.
doses is all depends on the consultant. It is up to your discrimination. If I find a patient and if I prescribing 200 potency, but your patient might require a 1M, 10M, or sometime a Bacamic 3x or 12x. So dose is always a question of discussion and matter of controversy with each and every homeopath. So precisely, just like a paracetamol 500 milligram or paracetamol 1000 milligram, it's not like with our homeopathy, because this based on the concept of individualization, and individual concept is with the patient as with the homeopath as well. So I would always recommend, I would always request that you just analyze the depth of the clinical pathology, how deep-seated abnormal pathology is with the patient, and accordingly, you can select the dose. Say, for example, a patient with acute hiccup, then Nux vomica 30 will cure the patient immediately. But if patient having a long-standing, or sometime what happens that maintaining cause. I got a one patient. Patient was developing a hiccup every now and then. I was giving small acting medicine, means short acting medicine like Nux vomica. After a few days again, patient came. Nux vomica was not worked on that patient. Then I tried to find out what about the maintaining cause. What about the causative factor that patient is coming 3, 4, 5 times in a month with the same complaint. Ultimately, with the history taking, I found that patient was taking a pyridostigmine, mastinon. And pyridostigmine is a medicine for the myasthenia gravis. And that myasthenia gravis was causing a sort of a hiccup to the patient. And I cannot advise patient to stop that mastinon, because if patient stop the mastinon, patient can't live. Patient develop a sort of a weakness. So in that case, we have to potentize that mastinon over here. We sent the tablet to the laboratory. They potentized it. That potentized tablet came to me. I administered that tablet to the patient, and patient became okay. And patient continued with the mastinon. So similia similibus curantur, like your slide, the same mastinon has cured the side effect of the mastinon. So this is the practical way. Sometimes we have to adapt.
Sir, what is your experience with the LM potencies?
LM potency.
Yes, sir.
Yes, it is giving a good result, I must say, but not with the frequent repetition.
Not with a frequent repetition.
No.
People used to say that you take a dose, a drop of this, or a pill of this, and put it in water and dilute it, and then give a sip by sip to the patient, so that it will get the patient will get easy cure like that. What's
No.
no?
Sometimes it happens. Even in my case, some 1 year back, I've been to India, and
Yes.
while lifting a heavy bag, I pulled my muscle. I was just searching a ruta. I take a 500 ml of water bottle. I put a ruta, 1M. I shake it very well. Throughout the day, I drank water from that bottle. And my pain completely gone. Completely gone. So that is called the serial dilution method. And that is helping a lot. And I am also advising my patient to take that route. So patient, all the time having a patient rehydrate. Second thing, the serial dilution is also acting like a magic, and patient will have a shortest period for the recovery. Patient doesn't have to continue treatment for a longer period of time. So this is my personal experience. And in my practice also, I'm advising the same thing.
Okay, sir. That's very, very good news.
Thank you, sir.
Another route is sublingual route. When you are diluting a mother tincture, and when patient having a hiccup, and if you put direct under the tongue, sublingual route, within no time, patient gets better. Within no time.
That
So
means the quantity is less required in those conditions.
yeah, 100 ml of water, 5 drops of mother tincture, and just put 2 to 3 drops under the tongue, and rest of the medicine, rest of the water you can give to the patient. Patient can take it with him and with her, and whenever patient develop again symptoms, then they can use it. And after 1 month, I tell them that if you are not using, just throw it.
Yes. Yes, yes. Now it's the time for Dr. Indran. Please unmute yourself.
Yeah.
Yes.
Thank
can
you, sir,
speak.
for allowing me. Yeah. Sir, would you like to suggest any diet for a hiccup patient? Because this is a common question asked to us.
This is a very tricky question
Yeah,
you have
yeah.
asked,
It very
because see, aversion and craving is such a thing that we all love food. And when our patient comes to us and if we say that, please don't eat this, patient will say yes to you, but after leaving your office, they will start what they want to do. So in that case, those who are obedient patient, they will follow you. Here, in my practice, I've seen that whatever we suggest them, whatever we advise them, no, hardly they follow. And they
Okay.
come again and again with the same complaint. So then we have to tell them that if you have to choose 2 things, treatment or enjoyment.
Okay. Sir,
then-
yeah, one more just addition. I'm using LM potencies quite a lot here in Pune. Aphorism 270 has explained very well, Dr. Hanuman, the 6th edition. So, like for those who are having queries of LM potency, can definitely take the advantage of reading it. So, it is
Yes,
just a humble suggestion. Yeah, thank you, sir. Yeah.
you are most welcome.
Yes. Now, Dr. Manoj.
Thank you, Dr. Dhanesh and Dr. Trivedi. As always, you are doing well. And this time, I think the hysterical hiccup is not mentioned in majority of textbooks. I only saw it in the Francis Index of Medicine. They all around this. I don't know about the recent textbooks, but early it was not mentioned in any books. I have a case of this hysterical hiccup when the patient is an old age person, is watching the television, and when India is about to lose the match, cricket, he starts hiccup. Severe hiccup. I got this medicine, Ignatia, and he was recovered.
Yes.
So this kind of practical application is only possible in homeopathy.
Yeah.
Then that's the most advantage thing. But what happens is that we don't have much this
Research,
not research, but
evidence-based thing.
institutions. They need big institutions, big this methods, nurses, staff, ambulance, and so many things. Definitely, they will believe it. If you give the sweet pills, they will not believe. That is our only limitation homeopathy has. Then again, you mentioned about this dilution of medicine. So it's a word of caution is that I think when you select the remedy, it will always create some sort of aggravation. So that's as suggested by our master. He always suggested dry upon tongue is the most suitable dose. When any emergency is there, dissolve in water.
Yeah.
So depending upon the selection, there are likely to be some aggravation when you dissolve the medicine in water. Anyway, congratulations, and you have endeavor in the UK. And you mentioned another important thing, the circumspection tact, knowledge of human nature. Yes, according to the situation in London, England, the people think differently. They will not follow the vision, as you rightly mentioned. But in Germany, this is the opposite. That's why Hahnemann always mentions those who care for health can find dishes at the king's table too. Moderation in everything is the expectation of master. The situation is different in England. Okay, thank you.
Yes, sir, in those conditions, if the patient like to take this vinegar, then we can give it as desire for or craving for vinegar like that. And so choose the remedy, and then we can administer it as a medicine. So thereby we need not to give, or you just avoid vinegar like advice. Am I right, sir?
Yes, you are right. But when patient have a craving for the vinegar or acid or some abnormal indigestible things, And when we give a remedy, then patient develop a aversion for that as well. In many patients, in young patients, children, they're having a tremendous craving for the chocolates over here. Especially in UK, I have seen that before period, that is called the premenstrual phase, ladies having a tremendous craving for the chocolate. So that abnormal craving for the sweets, considering that rubric in a children, I'm giving Sina to them. And parents give feedback that after having a Sina 30 or Sina 200, depending on the age, if we put a ball of chocolate in front of my child, he doesn't touch. So these are the evidence-based proof that what patient give us a feedback that after having a Sina or after having a shot of a constitutional remedy with the female patient, they are developing a sort of a control over their desire, over their craving, over their longing.
Yes, sir.
So,
Sir, what is your experience with the chocolate medicine? People used to say chocolate is a very good remedy in those conditions.
chocolate I have used in migraine, and really it has helped. It's a very good remedy. I have used chocolate, potentized chocolate, and I have used that for the migraine patient. But migraine patient having a abnormal craving for the chocolate during the attack of migraine, and I gave a chocolate, and patient was cured.
A few questions, Dr. Dhanesh. Please unmute the chat box, and few questions are there. Dr. Dhanesh, you're muted. Yes, please.
Yes, sir. Dr. Indrani is asking, sir, many dietitians advise vinagre to diabetic patients to control sugar, but in some cases, hiccup is observed. Should we take it as a maintaining cause?
Vinegar, apple cider vinegar is being used over here. A lot of patients are taking that. And with that also, we come across a patient with a acidosis. They get abnormal cramps in their legs. When they talk to us, we can feel that bad breath, that is called the fetor oris, and random itching on the skin. So recently I came across one research paper from the Aviva AccuCheck machine. So they have published a very good research paper about Karela, bitter gourmet. They have conducted a trial on a group of patients. So in the morning, they used to scrape the skin of the Karela, the bitter gourmet, and they watched the fasting blood sugar and postprandial blood sugar, and they found a miraculous result, and they have published that thing with their machine, the fasting blood sugar checking machine. With that, they are giving that leaflet as well. So it's a good research. The same thing is with the cholesterol. Those patients who are having a very high cholesterol, those who are taking atorvastatin, simvastatin, statin group of medicine, and many of the patients, they are developing a sort of a constipation. They feel bloated, they're having a heartburn, regurgitation and all. And for that, patient has to take the PPI, means proton pump inhibitor, like lansoprazole, omeprazole-like things. So University of Pennsylvania has researched on the pistachio. So use of pistachio, 63 grams. You can find this information on Wikipedia as well. The one handful of pistachio, if taken early in the morning on empty stomach, and patient having a significant reduction in the cholesterol. And I have experienced to one of my patient. That patient cholesterol was 7.5. And after 1 month, it has come down to the normal.
Okay, sir. It's the time to wind up the session. I invite Dr. Ramparesh sir to say vote of thanks.
Thank you, Dr. Dhanesh ji, and congratulations Dr. NIKUNJ TRIVEDI sir. Very nice presentation. Excellent session. This hiccup cause, causative factor, maintaining cause, etc. Hypertension, other symptom, yani therapeutic treatment according to homeopathy. Treat the patient, not the disease. Symptom, constitutional remedy is the very good action of hiccup. So very thanks, Dr. Trivedi sir, behalf of IFPH whole team. Very thanks. Presentation. Thank you, sir.
Hope
Thank
you
you.
like my presentation. That's the great appreciation for me. Hope you all like my presentation.
Thank you, sir.
Thank you.
Definitely. Thank you, Dr. Rambaresh sir. Thank you, Dr. Nikaj and Trivedi sir, and those who attend the session. Tomorrow we will have a session from Dr. Sanjeev Kumar Singh, and Doctor will be talking about case taking without connotation. That will be the the session for tomorrow. With that, we come to the end of the day. Thank you all.
Thank you.
Thank you.
Everybody can use the same link for tomorrow's session also. There is no change in the link. Video of the same will be uploaded tomorrow evening. It's over to Dr. Mariamma John to moderate the Malayalam session.
Dr. Dhanaj, please make Group sir co-host.
Yes. സാർ ഉണ്ടായിരുന്നു, പക്ഷേ സാർ ഇടയ്ക്ക് ഞാൻ നേരത്തെ ആക്കിയതായിരുന്നേ. ഞാൻ ആയിക്കോളാം.